Hello everyone, welcome back to our part 3 of civics chapter role of the government in health. So, we were studying that government is providing some services especially for poor who cannot afford to purchase them from market. So, what is government doing? Government is providing some special services to the poor because they cannot afford to purchase it from the market, which is an example of in healthcare. Now, another important function of the public health is to take action to prevent the spread of disease such as TB, malaria, jaundice, cholera, diarrhea, chikungunya, etc. So, they have said that one thing the government has all to also do, which is very important, is that public health is to be take action to prevent the spread of diseases such as TB, malaria, jaundice, cholera, diarrhea, chikungunya, and etc. And this has to be organized by the government with the participation of people. Otherwise, it will not effective. It is not effective. So this has to be organized by government. This organization, this important function has to be done by the government only. Government and some other people participation, otherwise it will not be done effectively. Participation of other people is also important for spreading, for going through homes, telling and more. For example, when taking up a campaign to see that mosquitoes do not breed in water coolers, rooftops, etc., and this has done in all houses in the area. So, for example, we take a campaign. Okay, we make a campaign, the government makes a campaign to see whether the mosquitoes are not breeding in the water coolers or the rooftops of water coolers, and this has to be done for all the houses to check. A doctor in rural health care center giving medicines to the patient is shown in this picture. According to our constitution, it is primarily a duty of the government to ensure the welfare of the people and provide health care facilities to all. So, according to our constitution, the way the things which in our constitution is written, they tells us that this is the primary duty of our government to ensure the welfare of people and also provide healthcare facilities for them. The government must safeguard the right to life of every person. So they must save that right to life of every person. If a hospital cannot provide timely medical treatment to a person, it means that this protection of life is not being given. So if a hospital cannot give timely, that means on time treatment, medical treatment to the person is not given, that means protection of life is not there. The court also said that it was the duty of the government to provide the necessary healthcare services, including treatment in emergency situations. So, court has also stated that it is the duty of government only to provide the necessary health services, including the treatments in the emergency situations. Hospitals and medical staff must fulfill their duty by providing the necessary treatment. So, hospitals and medical staffs have also to fulfill their duty for the necessary treatments of people. Therefore, the court asked the state government to give him the money that he had spent on his treatment, and also the court asked that the state government that the money which was spent on the treatment has to be returned back because no treatment was done properly. Here's a picture given in which a woman and a sick child at a government hospital. According to UNICEF, more than 1 million children die every year in India from preventable infections. About 1 million children are dying every day. 1 million children, can you imagine? Now we learn about private health facilities. There is a wide range of private health facilities that exist in our country. So in our country, there is a wide range of private health facilities which exist. So a large number of doctors run their own private clinics. So there are many number of doctors who are running their private clinics also. In rural areas, one finds registered medical practitioners, and urban areas have a large number of doctors, many of them providing specialized services. Now, what happens in rural areas, in villages, you can find only one registered medical practitioner, and in urban area, if you see, there are many large number of doctors, you can see, providing specialized services. There are hospitals and nursing homes that are privately owned. The government does not say that don't create them. There are hospitals, there are nursing homes that are privately owned by them. There are many laboratories that do test and offer special facilities such as x-ray, ultrasound, etc. And there are also shops from where we buy medicine. They have also made the shops from which we buy the medicine. They also do tests. They also offer these specialties, but in only urban areas. Private health facilities they are talking about. As the name suggests, private health facilities are not owned or controlled by the government. The name suggests private, so as the name only suggests that it is not controlled by the government. Unlike the public health services, in private facilities, patients have to pay a lot of money for every services they use. Government hospitals are very cheap, whereas if we talk about these private, they have to pay a lot of money for every service they are using. Now, today the presence of private facilities can be seen all around. So in today's era, we can see everywhere private facilities have been seen. In fact, now there are large companies that run hospitals, and some are engaged in manufacturing and selling medicines, and medical shops are found in every corner of the world. So in fact, you know that there are many large companies, they run hospitals also, some are engaged in manufacturing even medicines also, and medical shops are also found in the corner of the I think it should be corner of the hospitals. Country is given by mistake. A post-operative room in a leading private hospital in Delhi. It is a post-operative room in a private Delhi hospital. Healthcare and equality. Now, what is the relation between healthcare and equality? Is adequate healthcare available to all? So, is sufficient amount of healthcare given to all? In India, we face a situation where private services are increasing but public services are not. So in India, we see the situation where private services are increasing but public services are not increasing. They are just decreasing only or at the same level. What is then available to people are mainly private services only, and these are concentrated in urban areas. So only private services are available and they are only found in urban areas. The cost of these services is rather high and medicines are expensive. Medicines, if you bring from private, they are very costly, and also the cost of services are also high. Many people cannot afford them or have to borrow money when there is a illness in their family. Some private services encourage incorrect practices to earn more. You know, some private, because they are private, they also take extra money and incorrect practices so that they can earn more and more. At times, inexpensive alternatives, though available, may not be used. For example, some medical practitioners are found to prescribe superfluous medicines, injections, or saline when simple medication may suffice. Only simple medicine can work, but to just earn money, they give so many types of medicines, superfluous medicines, injections, saline. When it is not required, why are they given? In fact, 20% of the population can afford all the medicines that they require during an illness. So only 20% people in India can afford it. Now here's the box given. The Medical Council of the India's Code of Medical Ethics states every physician should, as far as possible, prescribe drugs with generic names, and he and she shall ensure that there is a rational prescription and use of drugs. See, all the medical councils of India is a code of medical ethics which state that every physician should, as far as it is possible, should prescribe drugs with their specific names, and he or she who is prescribing shall ensure that there is a rational prescription and use of drugs given also. Here if you see, this is a picture of Jain Aushadhi medical stores, dam kam dawai uttam. It is a central government to offer quality generic medicines at lower prices. Hence, even for those whom one might not think as being poor, medical expenses cause hardship. It was reported in a study that 40% of people who are admitted to a hospital for some illness or injury have to borrow money or sell some of their possessions to pay for the expenses. So it is reported that 40% of the people who come to these private services are borrowing the money, are admitting them in illness or injury, borrowing the money, selling their jewelry, selling their properties, their own properties for that treatment. Here's a picture given in rural areas. A jeep is often used to serve as a mobile clinic for patients. For those who are poor, every illness in the family is cause of great anxiety and distress. So the people who are poor, when someone becomes ill, it is a situation of great anxiety and distress because now they have to work more. What is worse is that this situation tends to happen again and again. Why only poor are getting these again and again? Those who are poor are in the first place in the undernourished, because they are the first one to be undernourished. That's why these families are not eating as much as they should. They are not provided basic necessities like drinking water, adequate housing, cleaning surroundings, etc., and therefore are more likely to fall ill, and the expenses and illness make their situation even more worse. So now what happened? They are not provided with basic necessities, drinking water, proper house, clean surrounding, and then they are prone to illness. The expenses on these illness make the situation more worse for them. The pregnant lady has to travel many kilometers to see a qualified doctor. So see, she's a pregnant lady and she has to travel by legs. She is walking and traveling to go to a qualified doctor. Sometimes it is not only the lack of money that prevents people from getting proper medical treatment. Women, for example, are not taken to doctor in prompt manner. Women's health concerns are considered to be less important than the health of the men in the family. So, it is not about that you are not having money. Actually, women's health is not taken in a prompt manner, not in a serious manner. Women are concerned to be, she is less important, and men are concerned to be health of the family. That's why many tribal areas have few health centers and do not run properly. Tribal areas are not even though having only and having one or two with not proper, which is not proper also, and even private health services are not available for tribals. See, why are they saying prompt and manner? See, if your mother must be there in your house, if she is having neck pain, back pain, she would say, okay, it's okay, it will get well in 1 to 2 days, not a great problem, no need to waste money on that, this. So this should not be done. Okay, explain your mother also about it, that you are the one who take care of us, and if you are not taken care by us, then we are waste. Sustainable development goal picture is given here. Good health and well-being. What can be done? There is a little doubt that the health situation of most people in our country is not good. It is responsibility of the government to provide quality health services to all citizens, especially the poor and disadvantaged. So, if they are not in the good situation, not in a healthy situation, so it is the responsibility of government. The government has to provide quality healthcare services to all the citizens, and especially the poor and the disadvantaged. However, health is a much dependent on basic amenities and social conditions of people as it is on healthcare services. So, moreover, health is dependent on the basic amenities they are getting, basic needs they are getting, the social condition of the people, and also the healthcare services. Hence, it is important to work on both in order to improve the health situation of our people. To improve the health situation of the people living in our country, it is very important. And this can be done. And how can this be done? There are some examples given, which has been done also, and some examples are given. Okay. The Kerala experience. In 1996, the Kerala government made some major changes in the state. So in 1996, Kerala government experienced something and made some changes in Kerala. 40% of the entire state budget was given to Panchayat. 40%. Can you imagine? Out of 100, whole 40% was given to village Panchayat. Only Panchayat. They could plan and provide for the requirements. So they were given to Panchayat so that Panchayats can plan and provide for the requirements. This made it possible for the village to make sure that proper planning was done for water, food and women's development and education. Why was this given? This was given so that the villages, to make sure that the people living in villages, the planning for water, food and women development and education was done in well manner. This meant that water supply schemes were checked, the working of schools and Anganwadis was ensured and specific problems of the village were taken up. So this means there were some schemes applied, there were many people who went and checked for the schemes if they are working, the working of schools, the working of Anganwadis. They ensured the specific problems of the villages, they were taken up and they were also solved. Health centers were also improved, qualified doctors were sent, and all of this helped to improve the situation. And now Kerala is actually a little healthy state. Despite these efforts, however, some problems such as shortage of medicines, insufficient hospital beds, not enough doctors remain, and these need to be addressed. So they are telling, despite giving these efforts also, there was some problem. Shortage of medicine, insufficient hospital bed, no space, not enough doctors, and these need to be addressed. These need to be solved. Let us look at an example of another country and approach to its issues of health. So here is a map given which shows the state Kerala in pink. This one is the Kerala. Now let's move to the next. The Costa Rican approach. The Costa Rica is considered to be one of the healthiest countries in Central America. So we talk about the Central America. So Costa Rica is considered to be the healthiest healthiest country. The main reason for this can be found in Costa Rican Constitution. Why it is the healthiest country? You can find this reason in the Costa Rican Constitution. Several years ago, Costa Rica took a very important decision and decided to not have any army. I am writing first point here. Costa Rica has taken a very important decision many years ago. It said that we will not have any army. They will not have any army. This helped the Costa Rican government to spend the money that army would have used on health, education and other basic needs of people. And instead of giving that amount of money to army, the government used it for health, education and basic needs of people. The Costa Rican government believes that a country has to be healthy for its development and pays a lot of attention to health of the people. So the government believed that for the health, it's for the development. Health for its development is important and it is paying a lot of attention to health of the people. The Costa Rican government provides basic services and amenities to all Costa Ricans. Every Costa Rican was getting basic services and all the amenities. For example, it provides safe drinking water, sanitation, nutrition and housing. Health education is also considered very important and knowledge about health is an essential part of the education at all levels. So they would also be educated about the diseases which are happening and get to know if they are facing that disease. So Thank you for watching this video. Subscribe and like for more such videos, and please comment if you want any chapter. Thank you so much for watching.